Today we're going to talk about where tartar really comes from, why it keeps coming back in the exact same spot in your mouth, and precisely what you need to do to prevent it. At first glance, tartar might seem like a simple cosmetic issue, just some annoying buildup on the inside of your teeth. But there is a much bigger health concern here that you need to know about. You can visually see tartar above the gum line, but it also grows down into your gums, causing inflammation, irritation, and bleeding. This opens up tiny holes in your gum tissue, allowing specific bacteria to invade your tissue and enter your bloodstream. This is why your gums might bleed when you brush. There is deep irritation and inflammation in the gum area. In fact, research shows that even after brushing your teeth and irritating the gums, bacteria levels can increase by 23%. Other studies show that a professional deep cleaning can actually increase bacteria in your bloodstream by up to 75%. That is bacteria traveling straight from your gums into your blood. What's truly wild is that DNA testing on heart attack and stroke patients has revealed dental bacteria inside their arterial plaque. How did it get there? Researchers also tested the synovial fluid in the joints of people with rheumatoid arthritis and found dental bacteria. How on earth did it get in there? Even with conditions like gingivitis, scientists are finding links between specific enzymes in that condition that can potentially trigger autoimmune diseases, particularly rheumatoid arthritis. I recall many of those cases involving underlying issues with teeth and gums. So, tartar isn't just a cosmetic annoyance, it could point to a much deeper systemic health problem. So, what is the actual difference between plaque and tartar? Plaque is essentially a soft, living bacterial biofilm that lives inside your mouth and hasn't calcified yet. The chemistry, or pH, of plaque is more acidic, and that acidic state increases your risk of getting cavities. Tartar, on the other hand, is essentially fossilized biofilm trapped in a chemical cement. Once tartar forms, it is completely impossible to remove with a toothbrush. It's simply not coming off, which is why your dentist has to scrape it away using a metal tool. Interestingly, tartar thrives in a more alkaline environment. An alkaline environment means fewer cavities, but it can lead to more tartar buildup. So simply altering your mouth's pH won't solve the tartar problem. Now, a lot of people ask me which supplements I recommend. Of course, I'm not biased toward my own high-quality supplement line, but if you go to Amazon and search for Dr. Berg supplements, you'll find more information there. Why does tartar keep forming in the exact same spot in your mouth?
Well, there are salivary glands located right below your jawline that drain through a small tube opening directly behind your lower front teeth. The saliva coming out of those glands is far more saturated with calcium than even your bloodstream. The issue isn't that you're eating too much calcium and it's settling on your teeth. That saliva is already primed to deposit a significant amount of calcium right into your mouth. Why do some people get tartar while others never do? Studies show that people who don't get tartar have significantly higher levels of natural inhibitory chemicals that block tartar formation. The problem is that once tartar forms, it actually destroys these protective inhibitory factors. So people who get tartar end up forming even more of it. Another crucial detail, when you go to the dentist to get your teeth cleaned and scraped, it is vital that they polish your teeth afterward. The rough surface left behind right after scaling creates the perfect terrain for bacteria to stick to and start growing all over again. Here is the missing piece of information you need to truly understand tartar prevention. It takes just 8 hours for crystals to start forming on the inside surfaces of your lower teeth. Within 2 days, up to 50% of that biofilm can become mineralized or crystallized with calcium. By day 12, 90% of those biofilms have fully transformed into hard calcium. Once that fossilized cement has formed, a professional dental cleaning is the only thing that will remove it. So after you've gone to the dentist for that scaling and made sure they polished your teeth, here is how you prevent it from constantly coming back. Step number 1. You must brush your teeth twice a day, not just once. Right before bed, make sure to spend extra time brushing the inside surfaces of your lower teeth. Aim for at least 30 seconds, getting as close to the gum line as possible. Step number 2, breathe through your nose when you sleep. If you sleep with your mouth open, you produce more saliva, which accelerates the buildup of plaque and tartar. Step number 3, choose a toothpaste that contains baking soda. Baking soda is anti-biofilm and antibacterial. Plus, it penetrates tiny crevices that other ingredients can't reach, making it fantastic for stopping biofilm before it starts. A couple of other great anti-biofilm ingredients to look for are xylitol and zinc citrate. A quick note for anyone on the ketogenic diet: you might notice slightly more tartar buildup. This happens because keto shifts your mouth's pH from acidic to more alkaline. The good news is that being on keto means fewer cavities and less overall gum inflammation, but some people may develop more tartar. This is likely due to changes in oral bacteria leading to increased protein fermentation, which alters your mouth chemistry. I definitely wouldn't change your diet because of this. Simply follow the steps I'm sharing here. People might assume keto is bad because of this, but while it prevents one problem, it only slightly increases tartar risk, and that won't happen if you practice these tips. I also have a free download for you, a printable checklist of my daily routine. This is the exact routine I follow every day to feel 18 years old, even though I'm 60, and I want you to have it for free. Just click the link down below to download it right now. To recap: 1. Brush twice a day. 2. Sleep with your mouth closed and breathe through your nose. 3. Use a toothpaste containing baking soda. 4. Make sure your dentist polishes your teeth after any cleaning. Now that you know the truth about tartar, you need to understand how internal, systemic infections originating in your mouth can impact the rest of your body. Watch this video right here for the full story. Check it out.